a lot of times what we get from trained nurses, trained health workers have not been posted. Some as far back as 2020, 2021, 2022. What is the state of employment now in that sector?
Good. So let's understand what exists in the health sector. Now, the previous administration took off office in 2017. And permit me to go in that direction a bit. They criticize us heavily for leaving backlog, not even more than 2 years backlog. We were criticized heavily. Now, when they took office in 2017, their first time of recruitment was done in 2020. Hear me well. In their first 4 years, they did only one recruitment in the health sector, nurses, in 2020, major. Okay. That was even in December 2020 before the election. And they began their service in 2021. Then after 2021, they never did any recruitment again until 2024. Can you get a coincidence? 2020, 2024.
Election years.
And then when they started the 2024 one, they never recruited. They left it onto us. And so now, as I speak to you now, this government is supposed to pay not less than 13,000 nurses, which they began the processes in 2024. So properly speaking, they did only one recruitment in the entire 8 years. Do you understand the trajectory?
Right.
Only once. And so we have the 2021 batch is what we came to meet in 2025. And that is the batch we are recruiting, and we have recruited, and we are looking for money for them. And out of the 13,000, about 10,000 have been captured on the payroll. Out of the 10,000, about 7,000 have been paid, and about 3,000 are yet to be paid. Okay? So we have the 2021 people at home. We have the 2022 at home, 2023 at home, 2024 at home. So in all, allied, pharmacists, physician assistant, nurses, if you put all of them together, we have not less than 70,000 health professionals that have been trained and are at home unemployed.
70,000?
You heard me right. This is what we have inherited. If we had added that 13,000, we would have jumped to 80,000 and over. If that sack people who were employed after 7 December, okay, happened in the health sector, by now we would have been talking about 80-something thousand people we inherited.
Because 13,000 people
would have added. And so these 70,000 people, there must be a clear strategy to deal with them.
Do you have one of?
That is what I'm going to talk about. We don't lament. Okay. We fix problems. So we have, I've talking about pharmacists and everybody in there, I've put them together. So the strategy is that as for the medical doctors, we recruit them every year. The last batch, we have done the recruitment, we are yet to post them. Now, this is what we're going to do. Government is looking at employing some of them almost every year to reduce the numbers. But the truth must be told that government cannot absorb all the 70,000 health workers within 1 year. So the truth is that even after 2026, there will still be some backlog.
Right.
You understand? So government is going to look at absorbing some of them, and then we are looking at how we can manage migration, export some of them to other countries.
Right.
And so for now, about 13 countries have responded. We are signing MOUs with them. They are looking at how they can get our nurses in their countries. Bahamas have written. Some very interesting countries have also written to us to get our health professionals. There's a problem that we need to fix, and we are fixing. What we have realized is that as part of the requests that come, we realize that most of the countries, they need the specialist nurses. and we don't have many in this country. And so we need to think outside the box to fix that problem.
To have
specialists to
right.
increase the number.
Right.
Out of those who have completed 70,000, so out of the 70,000, we have about 48,000 nurses. So what we are doing is that we are bringing up a program, the post-basic specialist program. Out of that, we are inviting some of the heads of the institutions, including the rector for the Ghana College of Nursing and Midwifery and all that. Everybody must come on board. How can we develop a curricula, a program to train these nurses within a short time for them to be specialists?
So help me understand your plan. How many are you hoping to retain here and how many are you hoping to send abroad?
So now, what we are intending to send abroad will depend on the requests that come. Okay? If you want to send about, let's say, 20,000 abroad and we have 10,000 requests, we can only send 10,000. Okay? And we'll also be very careful where we'll also not turn the coin, where we end up having less than what we need in the country. But of course, we are still producing more. And again, with this specialist thing, what we are doing is that those we are going to admit, we are looking at turning about 40 of the nursing training institutions into a degree, pursuing degree programs, nursing training institutions, so that we can increase what the demand on the global market is.
Yes.
So now back to my answer. We are developing a program. Instead of, let's say, 1 year or 2 years program, we're looking at how we can bring the number of years down to, let's say, a year or even 6 months. And we are at the table discussing that to solve that problem, to increase the specialists, that will be attractive to what the global market is demanding.
Right, but that's not something that could happen overnight.
No, it
you need to go through the loops.
No, we are at the discussion stages, and it's something we want to implement. I mean, latest by the end of this year.
By the end of this year.
Yes. We are very far, and we are looking at how we can use Kolebu and Konfanoche to come on board to solve a problem. Once we solve the problem, we may cancel that program.
I see. Now, I'll come back to this issue because I want to know what specialties you are hoping to train the nurses in post-basic nursing education, right? But when you look at the 70,000 number, how many are you able to employ this year in Ghana?
Again, you are putting me on the spot, and I do not want to give figures.
Okay. Because
for now, the 2026 budget has not been prepared. We've not even started the consultations on them. But very soon, because this year, you know, every budget in the past, except the election years, are being read October, November. You remember? Yes, so before it comes out, those figures will be there. And this time around, what we have agreed with the Ministry of Finance is that they are not to tell us which batch or which category of health professionals to recruit. Over the years, they will say, we are recruiting 10,000 nurses. But there are other categories of health professionals at home. We have the pharmacists, we have the allied. So what we have done is that, okay, if the budget can take 10,000, we'll then share it across, looking at the numbers. Of course, the nurses are always in the majority, and they will always have the higher percentage. But that would mean that we would have touched on pharmacists, we would have touched on allied, we would have touched on medical doctors, we would have touched on all the professions.
So as for 2025, no postings, no clearance.
Oh, yet. 2025 is what I'm saying, that we have taken about 13,000 on our budget. And this is even what we are struggling to pay all of them.
But those people were employed in 2024.
Did they pay them? Did they put them on the payroll?
I understand the dynamics of what you're saying.
So it means
but
that
I'm saying
that number will not allow us to put more on the 2025 because we need space to pay them. And as I speak to you now, I've told you that about 3,000 to 6,000 of them have not been paid. So you cannot go and add more. I mean, what you have even recruited, you have not been able to pay all. You understand? And so that is what they did, a similar one to us in 2008. When President Kufuor was leaving, you realized that he announced the single spine salary structure. And we came to for that exactly a similar situation. You just announce, they leave, and you have to come and deal with the physical space.